Good morning. On behalf of all of us here at the Cooper Institute, we welcome you to our Coffee with Cooper virtual series that focuses on taking control of your health and working towards a healthier future. This series presents up-to-date health and wellness information and offers suggestions for healthier living based on proven science. I am Dr. Laura Defina, President and Chief Executive Officer of the Cooper Institute. For those who are not familiar with the Cooper Institute, Dr. Kenneth H. Cooper, the father of aerobics, established the Cooper Institute nonprofit in 1970 to promote lifelong health and wellness worldwide through research, education, and advocacy. By improving public health, the Cooper Institute helps people lead better, longer lives now and well into the future. It is my pleasure today to welcome Dr. Riva Rahl, Platinum Preventive Medicine Physician at the Cooper Institute Clinic. Dr. Rahl received a double Bachelor of Arts at Rice University and a Doctor of Medicine from the University of California, San Francisco School of Medicine. Dr. Rahl then completed her internal medicine internship and residency, followed by a residency in emergency medicine, where she served as chief resident for 1 year at the University of Texas Southwestern Medical Center in Dallas. She is certified by the American Board of Internal Medicine and the American Board of Emergency Medicine. Dr. Rahl is author of Physical Activity and Health Guidelines, published in 2010 by Human Kinetics, if you want to get a copy. Today, Dr. Rahl is discussing the many ways how sleep can improve your life and why it is important to respect our sleep. We will have a few minutes at the end for her to answer questions you have submitted in advance. In addition, you can also use the Q&A function in Zoom. We will get to as many questions as possible. Riva, thank you for joining us today, and I so look forward to your lecture. I promise I will stay alert and awake the whole time. Thanks.
Thank you for the introduction, and thank you for having me here to speak today. So let's get started here. A lot of people want to know about sleep because we spend about a third of our lives in sleep, and this can have as much of an impact as many of the other things we talk about: diet, exercise, and other ways we can improve our health and well-being. So I just wanted to talk about how much it's important that we respect the power of sleep and respect the amount of time we sleep. There was a quote from the Journal of the American Medical Association in an article about sleep that said, "Lack of quality sleep may contribute to love handles and a double chin." And I know a lot of us are concerned not only about the quality of our sleep, but the quality of our body. And it seems that not enough sleep or not enough quality sleep can contribute to obesity and overweight. Why do we need sleep? Well, we need sleep to recharge our bodies and to recharge our brain. Many people don't know, but there are hormones which are secreted in different parts of the sleep, which we will talk about, which help with growth, which help with insulin sensitivity, which help with improving our metabolism, and also improving our memory consolidation. There's a concept called brain cleanup, which happens during sleep, which allows us to sort of almost do what our computers do, which is get rid of the junk files, consolidate the things we need to see, organize them, and then put them in a place where we can access them when we need them. Our immune system is also very sensitive to sleep. Getting inappropriate amounts of sleep can affect our immune system in such a way that we are so much more susceptible to infections, which I think is an important thing always, but even more so over the last 2 years for us. Many people can have symptoms that they notice when they don't get enough quality or quantity of sleep. And these are listed below: fatigue, mood changes, decreased ability to concentrate, decreased ability to recall information. But those are only things that we notice. Sometimes we don't necessarily notice an insulin resistance or something like that going on, but I want to make sure that you're aware of some of the other impacts of sleep. How much do you need? There's so many different things out there, but I think this picture here gives us a very good idea about sleep. My teenage boys will argue with me all day long about how much sleep they actually need. I mean, I'm only a double-boarded physician. What do I know? But in general, for most adults, 6 to 8 hours is the minimum. Everybody's a little bit different, just like your heart rate during exercise may be different. A lot of people can say, I don't actually need that much sleep. But the best way to find out is to allow yourself a full night of sleep, no alarm, dark room, go to sleep, sleep until you can't sleep anymore. You may be surprised at how much sleep you actually need. Most of us operate on a constant sleep deficit, which contributes to chronic disease and many other issues. At least 1 in 3 adults don't get enough actual hours of sleep, but I think the number is a lot bigger for the number of people that don't get enough quality sleep. So here's some sleep basics. We have REM sleep and non-REM sleep. And REM stands for rapid eye movement. So there are different types of waves. If you were to do an EEG, which is an electroencephalogram, to look at the brain to see what type of waves are present in the brain, meaning what types of wakefulness. So there's something called beta waves, which are essentially what we have when we are awake. There are alpha waves. These are as we are going to sleep, but they're vivid as we're relaxing and slowing down. And the delta waves. And the delta is the deepest part of sleep. Now, it's interesting with the alpha waves, some of you may have noticed as you're drifting off to sleep or a partner in bed with you is drifting off to sleep, there's what's called a myoclonic jerk. You may feel your own myoclonic jerk as your muscles are relaxing, almost like a muscle twitch. And this is during that short alpha wave period of sleep. So when we break it down further, stage 1 is a light sort of transition from being awake to falling asleep. In stage 2, the body temperature drops. And stage 3 is when the muscles relax, the blood pressure and the respiratory rate drop. About half of your sleep is in stage 3. Now, it's really interesting when the body temperature drops, that is when your body is actually secreting melatonin. We all hear about melatonin as a sleep aid, and we need it for this, and it might help with jet lag. So very interestingly, your body requires a temperature drop in order to secrete melatonin. Most of us adults, somewhere between 9:30 and 10:30 p.m., start to secrete melatonin. The optimal way to get the best amount of melatonin that you need for your body is for your body temperature to drop 1.5 degrees. This is why there's some recommendation to do light exercise before bed or take a warm bath so that your body temperature elevates slightly, and then keep the room cool as you're going to sleep so that you get sort of a net drop of 1.5 degrees. The optimal temperature, many spouses disagree on this, but the optimal temperature for sleep is about 65 degrees. And that is to allow for that 1.5 degree temperature drop in order to optimally secrete the melatonin that we need. Now, there's another interesting sidebar about the melatonin I just want to add in for those of you. I don't know how many adolescents there are on the lecture today, but I'm sure some of you have adolescent children or grandchildren. It's frustrating to many people that these teenagers stay up late and sleep late, but it's not just because they want to. Naturally, the adolescent brain secretes melatonin 3 to 4 hours later than adults. And so instead of 9:30 to 10:30, their natural melatonin surge is coming around midnight. This is why they're not really tired when we are trying to force them to go to bed and force them to get along with the world, which goes to bed earlier than they are ready for. This fact is well known and has been presented to many high schools and administrators in this country, which is why there's been a trend toward later starts in the morning for high school, because that gives these teenagers a better chance of higher quality sleep, memory consolidation, improvement in mood. So in the REM sleep, this is quite a bit after falling asleep. The body is relaxed and usually immobile, almost paralyzed. This is when dreams occur. The respiratory rate can increase, and this is about 1/5 of our sleep. So interestingly, the cycles for sleep doesn't necessarily go 1, 2, and 3. It goes from stage 1 to stage 2 to stage 3, back to stage 2, then into REM sleep, then back into stage 2. It repeats throughout the night. And so if you don't get enough sleep, you may only have 1 or 2 sleep cycles. Or if you get adequate sleep, you may have more. As the night progresses, as you are in further repeats of this pattern, the REM stages get progressively longer. So this is why it's important, if the REM sleep is important, to get an adequate number of cycles of sleep. So here's just a picture, a nice graph. You can see REM sleep, stage 1, 2, and 3 sleep as the cycles go on, and you can see progressively longer amounts of time in the REM sleep as the night goes on. Now, if you only get a couple of cycles of sleep, you can see your total amount of REM sleep is very truncated. So what happens if you have deprivation of REM sleep? It can happen if you just simply don't get enough hours of sleep, or for whatever reason, medications, non-medication, but other substances which suppress your ability to get into the REM sleep. Some antidepressants may contribute to that, which is unfortunate because many people can't sleep well without an antidepressant anyway. But if you don't get enough REM sleep, your metabolism may decrease, your pain tolerance is lower, and so you'll have increased pain sensation. And then some of the parameters for cardiovascular health, blood pressure, metabolism are depressed, so that you have an increased cardiovascular risk. There's a list here of things that suppress REM sleep. Well, we're probably all not surprised that caffeine, which is a stimulant, may suppress REM sleep. But a lot of people are surprised when I tell them that alcohol can suppress REM sleep. They will tell me, but I have a glass of wine and it helps me relax at night. And my answer is, you might be able to fall asleep, but you can't stay asleep, and you're not getting the quality of sleep. And what alcohol will do, you may be able to get into stage 1, 2, 3, but then it doesn't go back to stage 2 very well. You don't have very much time in the REM sleep. And then the other thing is, after one complete sleep cycle, there's some wakefulness, because alcohol is a central nervous system stimulant. And then there's a lot of awake time before going into the next sleep cycle. So there's an inability to continue sort of this seamless pattern through the sleep cycles. Other legal and illegal substances can suppress REM sleep. Marijuana, opiate drugs, benzodiazepines, those are like Xanax, Valium, lithium, and then sleep apnea. Sleep apnea is another very common problem in our society. The issue with sleep apnea is individuals with sleep apnea often stop breathing for whatever reason, and they're constantly waking up in the night, maybe 50 times an hour. And so even though they don't feel themselves waking up, there's a wakefulness. And so they stay in stage 1, maybe stage 2 sleep, never get to stage 3, never get to the REM sleep. And I tell people, if you have untreated sleep apnea, it's like pulling an all-nighter every single night. And you can imagine the stress on your body, the stress on your brain, the inability to cope with things, the immune system function for untreated or undertreated sleep apnea. So we've been talking about how bad this is if you don't get good sleep, but why? Well, it's stressful to our body. The metabolism is decreased, and part of that is because if you have a lot of wakefulness, it can increase our cortisol production, which then increases our ability to store fat, particularly in the belly section, belly fat, which we call, apple shape instead of pear shape, or sort of metabolic fat. As a result, other endocrine functions are adversely affected. These include your sex hormones. I tell men with low testosterone, the first thing you need to do is a sleep study. I will say, by and large, the largest reason that men have low testosterone is poor quality sleep, usually sleep apnea, but there may be poor quality sleep for other reasons. The issue is in the deep REM sleep, the pituitary in the brain secretes a hormone which tells the testicles to make testosterone. If someone is not getting enough REM sleep, that message isn't going through, and there's no reason for the body to make testosterone. And so instead of getting a patch or a shot or a pellet, maybe they should get a sleep study, a CPAP machine, or work on getting more hours of sleep. Other things that are affected include the blood sugar, and that is impacted because what I spoke about before with the cortisol increases our insulin resistance, which therefore makes our blood sugar higher, which can lead to type 2 diabetes. Infections, cancer, and autoimmune disorders are higher in people that don't get enough sleep because of the cytokines and other what I call bad humors that are circulating, that are higher, inflammatory markers that are higher in people that don't get enough quality or quantity of sleep. Another thing you may have heard in other lectures are 2 other hormones called leptin and ghrelin. So leptin is what gives us satiety and makes us feel like we don't need to eat more. And ghrelin is the opposite. Well, poor quality sleep gives us the bad combination of low leptin and high ghrelin, so that we're feeling that we need to snack and would eat more than we would otherwise eat simply as a result of poor quality sleep. We see this a lot in night shift workers who have disordered sleep just because it's pretty hard to maintain a good sleep schedule, not only when you're sleeping when other people are awake, but also because there's some shift back and forth depending on days off. Let's see, I think I hit the wrong button. Let's try this. Oh, this one. Okay. Other hormone changes, like I said, increase cortisol, and then human growth hormone kind of goes along with testosterone, in that if there's no deep sleep, REM sleep, or slow wave sleep, human growth hormone is decreased. Something a lot of us, particularly in Dallas, are concerned about is our skin, and collagen is broken down more in people that don't get high quality sleep, and therefore that contributes to more wrinkles and sagging skin. Well, let's talk about weight, because that's something that I think is important from our research at the Institute, but based upon studies, individuals who sleep fewer than 6 hours consistently have a 30% increased risk of becoming obese. And in another study from the UK, decreasing sleep by 2 hours from sleeping an average of 7 hours a night to 5 doubles the risk for cardiovascular death. And that's felt to be related to the inflammatory markers, the increased cortisol, the increased blood sugar, among other things. Increased risk for accidents. And we're all familiar with various different things where people don't have as much focus, awareness. I was always concerned when I was working night shifts in my residency about getting home safely after a night shift, simply because I hadn't had quality sleep. My sleep patterns were disrupted, and I wanted to make sure that I was going to get home okay. There was a resident at the time who had gotten into a car crash coming home from a night shift and passed away. Memory and cognition. This is one of the things I try to preach to my teenage boys who are trying to get good grades so that they will be encouraged to get good sleep. If you don't get quality or quantity sleep, you'll have decreased attention, alertness, concentration, ability to problem solve, and reason. Also, not getting enough sleep increases our risk for depression. Well, I talked about this before with antidepressants, which may decrease our REM sleep. It's sort of a little bit of a problem. If the medication might interrupt our sleep, why do we take the medication? But if we have untreated depression, we may not be able to sleep because insomnia is a major risk and symptom of depression. So we're not sure necessarily if the depression causes the insomnia or the insomnia causes the depression, but we do know that there is a link. And then ultimately our immune system will function because a lot of the cytokines and markers that help us with our immune system simply are not produced when we don't get quality sleep. We've talked about all these bad things. Let's talk about some good things. Exercise. This is one of my favorite things. It's pretty much the answer for everything for your health. It's the best medicine there is. So there was a study out of Stanford about 25 years ago. This was over 4 months, men and women, 50 to 74 years old, who were exercising at least 4 times a week. Not only did they fall asleep earlier, they slept longer. And like I said, it's kind of the cheapest, easiest medicine. Plus, in addition to the benefits for sleep, we all know there are other benefits for blood pressure, cholesterol, diabetes risk, mood. So what else affects your sleep? Well, your lifestyle, your environment. If you're a night shift worker, you may have more difficulty. If you're trying to sleep in a setting where things are beeping, the lights are on, the dog is in your bed, licking your face, you've got a baby in there, these sorts of things can affect your ability to sleep. The perfect sleep environment is 65 degrees, quiet, dark. You haven't had a phone for 45 minutes in your face. You haven't had a screen on. And sometimes that's not realistic for us, but we can certainly do the best we can. Your exercise pattern affects your sleep. As I said on the previous slide, regular exercise helps your body prepare for sleep. Part of it is your body needs the sleep to restore, but also if you do exercise, sometimes that helps with the body temperature regulation. A healthy sleep schedule is imperative. Switching bedtime by just 1 hour can have a very harmful effect on your sleep. This is frustrating to those of us who like to go out on the weekends and think, oh, I'll sleep in. But this is the equivalent of traveling from one coast to the other. If you stay up a few hours later and sleep in a few hours later. And the question is it better to try to keep the sleep schedule and get up early on the weekend and maybe not get enough sleep? Or is it better to just sleep in, get all that extra sleep, but then have your sleep schedule off? I don't know the answer, but it's definitely contributing to difficulty if you don't have a very set pattern and try to go to bed at the same time every night. Food affects our sleep. I'm sure some of you recognize if you have a lot of simple carbohydrates late, it's more difficult to sleep. Sometimes foods that can cause acid reflux may interfere with sleep because the acid can wake you up. But the other thing with carbohydrates or eating too much before bed, even if it doesn't cause acid reflux, it can cause a surge of insulin And sometimes there's a surge of cortisol, and it has the same effect that caffeine or alcohol will have, in that it decreases your REM sleep. The amount of water you drink can affect your sleep as well. If you drink too much water, you may wake up with a sensation of having to use the restroom. If you don't drink enough water, the dehydration can wake you up. Like everything, it's sort of like Goldilocks, not too much, not too little. We want to have just the right amount. Stress, of course, plays a role in our sleep, because if you have ongoing stressors that are constantly in your mind, you may not be able to really wind down and relax. And or in between sleep cycles, it may cause some wakefulness. You wake up and the stress is on your mind, and it's more difficult to get back into that next sleep cycle. Well, I've talked about a few things that will help with sleep, and I call this sleep hygiene. The first one, where I say relax for an hour, it's hard to wind down. I can remember when I would come off a swing shift in the emergency room, I think, okay, I'm getting off at 11, I'm going to come straight home and go to bed. But when you have a lot on your mind and things have been go, 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 it's hard to immediately close your eyes, even if you're tired. So relaxing can help prepare your body and your mind for sleep. Relaxing, I always tell my kids, also involves not stimulating your brain. And that means not having the screens on. Now, if you're going to watch a quiet, National Geographic, peaceful documentary on TV, that's probably going to help you sleep more than a violent, loud, flashing light type of program. If you can avoid work-related activities before bed, that will help promote a better sleep environment. I know that was difficult for a lot of us the last couple of years, when there were very blurred lines between home and work life, as many people were working from home, and it seemed that the workday just extended well into the night. Pets can be helpful if they're not licking our face in bed at night, because that provides some enjoyment and some peacefulness, and also probably distracts us from doing other things like being on the internet or watching violent TV. I talked about the schedule. Even if you're not traveling, if you effectively change your bedtime by a few hours, that almost causes jet lag in your sleep. The hot bath or shower will help, because it raises your core body temperature just slightly to allow for that drop when you keep your room at 65 degrees, to have the melatonin surge, which helps promote the deep REM sleep. The dark room is helpful too, because it reduces stimulus to your brain and therefore will help keep you asleep in between sleep cycles. The other thing that's helpful is during the day getting natural sunlight, which stimulates a part of our brain called the pineal gland, which then promotes wakefulness in the day. And then in contrast, you have the sleepiness and ability to sleep at night. That also helps with melatonin surge at the other part of the day. Well, if I can't sleep, should I take something to help me sleep? A lot of people talk about melatonin. And if you go to buy melatonin, you can get it as low dose as 0.1 milligrams. And I've seen pills as high as 10 milligrams. I think the optimal amount that's been studied for sleep is 3 milligrams. Some people will say, I can't tolerate it. I have nightmares or vivid dreams. Some people feel that it's very helpful. I would say it's the least harmful of the things out there that can help you sleep. There's a question in adolescents, should they take melatonin? It's also helpful. It may delay the onset of puberty by a few months, but it doesn't change anything else. And if the adolescents can get high quality sleep, that may be helpful. Many people take Benadryl, which is an allergy medication, because it can make them drowsy. Benadryl is, or the same ingredient in Benadryl is what's found in NyQuil and some of the things like Unisom, which are just branded under a different name for sleep. It will help with sleep, but there are some side effects such as dry mouth, Some people may have some urinary retention. And then the half-life of Benadryl is 9 hours. So I tell people, if you have to take Benadryl, take it at 9 p.m. Don't take it at 2 in the morning when you've woken up and you need to get back to sleep, because that's the equivalent of taking half a pill at 6 or 7 in the morning when you're really trying to wake up and you're already a little bit drowsy because you haven't had high quality sleep. So a lot of us have a lot of access to technology, wearables, getting biofeedback about things, whether it's a Fitbit, an Apple Watch, there's something called an Oura ring, a Whoop. Many of these things now give us feedback about our sleep. I don't know if they're perfectly accurate, but what I do know is it provides us more data points, and people have awareness, and people can think about it and make changes and see night over night for them, for their own data points, how that can impact their sleep. And I think on an individual basis, that's very helpful, especially with the insight and awareness that, you know, I had the pizza and a bunch of junk food before bed and my sleep quality was poor, or I went to bed so much later and my sleep was fitful, that sort of thing. And also being able to track how many hours you're actually asleep, I think sometimes gives people an awareness they didn't realize they really were cutting themselves short every night. When I've talked about night shift workers, it's just simply hard. Even people who stay on the night shift, the data has shown that sleeping in the daytime, the quality and quantity of sleep is reduced. I will say from my own experience, when I worked night shifts, I usually did 5 12-hour shifts in a row. But when you got off and it was the daytime, instead of imagining that it was nighttime, you would think the bank is open, the grocery store is open, I can do things and see people, and part of it's just a psychological challenge to really sleep when you need the sleep. And as a result, night shift workers have much higher risk for overweight and for cardiovascular disease, as well as cancer. What about nappers? A nap can help, but a nap cannot make up for inadequate sleep. A nap can help if you do 30 or 45 minutes, but if you do longer than that, then you're going to upset your sleep cycle. And as a result, the sleep the following night will be compromised, and then it leads to a vicious cycle. So if you do need to eat before bed, what's helpful? Something that will stabilize your blood sugar may be helpful. Something that sends it on a roller coaster will not be helpful. Of course, late at night, we tend to snack on things we might not need to, but a glass of milk will be nice, particularly if it's warm, because that might help with the body temperature. Something that's higher in protein. And then a lot of times the foods that are higher in protein may also have more tryptophan, which is an amino acid that will stimulate melatonin production. This is why we think, oh, after the Thanksgiving dinner, we feel like we're about to pass out and sleep because of all the tryptophan in turkey. But there are other foods that have quite a bit of tryptophan, peanuts, eggs, dairy products, chicken, bananas. So these are things that may be helpful before bed. So we have some resources here, and you can get some health tips from cooperobics.com website. And not only are there some tips about sleep, but there are tips about many other aspects of your health as well. So I think I'm going to pass it back to Dr. Defina for some questions.
Excellent. Dr. Rahl, thank you so much for such an excellent lecture. I think I'm going to make the case for my cat sleeping with me because that makes me calm. Excellent. And I think the information about the teenagers is so critical because I think your house, like many of our houses, have that ongoing battle of when should we be going to sleep. Okay, so I have a couple questions based on questions that were submitted before. First, white noise machines and white noise on our cell phones. That is really trendy today, yet I heard several times quiet room. When do we use these white noise machines or listen to the beach in our house in Dallas?
Well, it depends. If for you, absolute quiet is what is calming and will promote sleep, then don't put on a white noise machine. However, for many people, the white noise can drown out the traffic outside, the dog barking, other things going on, that may be what is considered quiet, meaning that it's sort of dampening the other things. And so I think each individual can find out whether or not that is something that promotes their sleep. I don't think there's a problem with it, but I would actually categorize white noise in with quiet, because essentially it's sort of drowning out or limiting other intermittent noises with just sort of a low, almost drone background.
Excellent. Okay, in terms of sleep aids that you can buy over the counter, Benadryl, Melatonin, people worry that they're addictive, and people worry that they might not be able to sleep normally if they stop them after they've used them, say, for jet lag. Can you comment a little bit more on those medications, and at what point to go to your doctor and ask for all those medicines that are advertised on TV?
So I will say Benadryl and melatonin are not addictive. Now, sometimes if you rely on melatonin to fall asleep and you stop taking it, there may be as much of a psychosomatic inability to sleep as there is a physiologic one. And as I said, I don't think there's a problem with taking melatonin every night, as long as you don't have adverse effects like vivid dreams or it causes a problem for you. When you go to non-over-the-counter sleep aids, Ambien, Zolpidem, Lunesta, Sonata, there are a whole bunch of them. These can become addictive, some of them. And additionally, there are other adverse effects that have been observed. I think the one that stands out to me that I discuss with my patients the most is that there is a link to dementia in people that are chronically taking prescription sleep medications, which is very concerning to me. Now, if you can't sleep at all at night, that's also concerning, and that can lead to memory loss. But there's a fine line and there's a balance. And I think a lot of people that use and seek out prescription sleep medications still have room to improve what I call sleep hygiene, to avoid needing a prescription medication, which there can be a tolerance that builds up, and there can be some rebound or difficulty falling asleep after discontinuing the medication.
Excellent. Now, one area, you talked about testosterone, but one area that we actually received several questions about is menopause. And during menopause, we get hot flashes, but we also get sleep disturbances. So what are your recommendations to help women going through menopause? And what if they can't take hormones, which certainly is one of the treatments? What do you recommend to the woman in that phase of her life?
So this is a question I get every day as well. Hot flashes, night sweats, mood swings, inability to sleep. All of these things really can be disruptive. However, if hormones aren't an option due to the personal risk-benefit ratio, we have lots of other things, supplements. And I say, again, sleep hygiene plays a role. Keep the room cooler, wear layers so that you can, if a hot flash is coming, you can cool off. There are supplements such as black cohosh, evening primrose oil, ashwagandha, magnesium glycinate. all of these can help promote relaxation, promote sleep, particularly in menopausal women. And I know there are different formulations that can help. There are even prescription medications that aren't hormonal, if hormones aren't an option, that aren't sleep medications per se, but can help reduce what I call the vasomotor symptoms, hot flashes and night sweats, that adversely affect a menopausal woman's sleep. So I think there are options. But ultimately, for some women, hormones are the only way they can get appropriate sleep. And I say, then, take the risks, take the benefits, and then go on the lowest dose you need that helps you with whatever symptoms you have, and revisit it with the ultimate goal of reducing off of it if the risks associated with it are significant for you.
Excellent. Okay, so the next generation beyond that, you showed us in that early slide that the more advanced elderly get less sleep. But a really common question for clinicians is, I'm not sleeping enough in a 75-year-old man or woman. So how do you balance this is normal with, do I need a medicine for my insomnia that I've gotten?
Yeah, that's hard, but that's something that I see every day too with my older patients who are concerned. I wake up early and I can't go back to sleep. Is that pathologic, or is that a normal physiologic age-related phenomena? And I usually say, well, it depends on how you're functioning in the day. How's your memory? How's your concentration? How's your focus? Are you falling asleep at the wheel? Those sorts of things. And, determining, is this a problem, or is this just a normal phase of life that you're progressing toward?
Excellent. Okay, and the last question, I'm going to focus a little bit on an activity that you and I like, which is physical activity, and the whole concept of the weekend warrior. The physical activity guidelines tell us we need to get at least 150 minutes. And some people say it should be spread out, but there's some people who say you can get it on all over the weekend. So here's a question that I thought was really novel. Can you make up for not sleeping well during the week by sleeping a lot on the weekend? And how long can the body stand consistent sleep deprivation?
So I feel like there's more than one question in there, but I'm glad you're talking about physical activity too. I could do a whole week's lecture on physical activity. I don't think you can bank sleep. I remember my dad told me when I was younger that when he was in law school, he would stay up studying so much, and then he would sleep 18 to 20 hours on the weekends to make up for it. And I thought, that doesn't really make sense. We sometimes will sleep many, many more hours on the weekend to make up for the ongoing sleep deficit that we incur during the week. But the problem is it doesn't work in the long run because of the interruption in the sleep cycle, maybe going to bed earlier, maybe sleeping a lot later. Again, that produces some jet lag type phenomenon. And also, you need that ongoing sleep on a daily basis, because if you think about all the hormonal aberrancies that happen with sleep or lack of sleep, then maybe you have 5 days in a row, not enough growth hormone, not enough testosterone production, too much cortisol, too much insulin resistance. Reversing that or decreasing that phenomenon over 2 days over the weekend isn't going to provide for a healthy balance overall. And so I don't think it's quite the same as physical activity. Some people simply, due to the demands of job or family or financial instability, simply have to operate on fewer hours of sleep than they need. But I don't think making up for it on the weekend is a good long-term solution.
Excellent. Well, Riva, thank you for an absolutely superb lecture with so much practical information. Thank you to everyone who joined us today. Please check out our website at thecooperinstitute.org for upcoming Coffee with Cooper sessions. And again, have a great day and get a great night's sleep. Thank you so much for joining us.